My name is Raydeen Busse. I am an OB/GYN and I actually subspecialize now in gynecologic and obstetrical ultrasound. We were one of the first phase of groups that signed up, and at that point actually there weren't even any financial incentives for us to sign up, but we thought it was a good idea because we could see the future of where this would be in terms of connecting all the different electronic medical records and physicians' offices. Initially I was a bit concerned that it would be another thing that my staff had to learn, another electronic medical record. I was concerned that it was going to be burdensome to all of us, but as we got trained and the training was so easy, we found that it was mutually satisfying, that they were happy with the reports that we were able to put in for them. Scheduling their patients was easy. It didn't require all this phone calling back and forth. We had a paper trail, if you will, but it was an electronic trail of how we were communicating with each other. Whether the doctor's office asks us to do the scheduling, which is fine, we can schedule the patient for them, or they've already called us and scheduled an appointment, but now they're sending the referral. I think the communication is a lot better. And time-wise, therefore, better because they're not playing phone tag all the time. Or sometimes doctors' offices prefer to message rather than to pick up the phone because they're being bombarded by other phone calls. The reports are so much cleaner, and with being an ultrasound practice, we submit a lot of ultrasound images, and through the fax machine, basically, you're not going to get any nice images, so we actually stopped faxing our image sheet of our report. But with HIE, we can put all of it through there, and one of the first doctors that we worked with, the first thing she said to us was, "Wow, the reports are so clean and easy to read. This is great." I just spoke to another physician who just got trained in HIE but hasn't used it yet, and I just said, it's so easy. You just need to give us a call if you want us to hold your hand during the first referral. So it's just getting them past that initial phase of, it's another thing that I have to learn. It's another thing that my staff has to be trained on. I'm a little bit nervous about piling more things on them. So for me to be able to just tell them, hang in there and just go through that initial phase, and the rest is basically duck soup.
So before HIE, we would have to get a lot of information from doctors' offices. So 3 months ago, it was a lot of phone tag, just a name, phone number maybe, and I would have to call, get information. And now we have all the questions set up where it has all the information we need. There's no phone tag, there's no calling. Everything's done with a couple of clicks on the button, and it cuts down on phone time a lot.
Training was very easy. The people came to us and we didn't have to go anywhere. It was in our office. We had everything set up. The interface in terms of how it looks visually, it's very clean and very user friendly. The fax can sometimes get distorted as it's coming through, or we can't read the handwriting or whatnot. That's not even an issue now with HIE referrals. Those that are taking advantage of the referral system through HIE have actually less work to do in their hands. They've been putting in the referrals and they include all the pertinent information, and they know that we're going to take care of it for them and take care of their patients. I think communications with the doctor's offices has been easier. Sometimes they're hard to get of via the phone, so the messaging system has worked to our benefit immensely.
I like it when the doctors, of course, don't have to call us and ask when is the patient scheduled for. They can check themselves already. It will give us a signal that there is a new referral from the doctor, and then we can print out the referral, and then it's done, patient's ready. But if we can't get a hold of patient, I like the messaging trail on HIE. Instead of calling the doctor's office, we send them a message, submit it, and then the doctors or the assistant can see that we're trying to get a hold of patient and we're waiting until patients schedule an appointment.
It's kind of amazing how it's all of a sudden a light bulb goes off or something that they say, oh, that was pretty easy. Right? And then next thing you know, every order is coming through HIE because it's become that simple for them to submit it, their patient to be seen, and then for them to get the report from us and input it into their EMR.
HIE and the trainers and the staff has been very helpful along the way. They've always been available to answer our questions. They come to you and do the training.
The potential of this system, when it's used to its potential, is going to be an amazing thing. Most patients that come to see me, they really don't have a handle of what kinds of tests they've had or why they're even being sent for their exam. So to be able to go into a medical record system that pulls in tests that they've had at a hospital or at an ER visit, tests that or notes that their doctor has written in their private hospice, those things are going to make me take care of a patient better and better address the concerns that the doctor who's referring the patient to me has. Things if we can connect all these systems, it's going to be amazing in terms of how much better we can care for our patients without duplicating services.